Welcome to Season 7 of Open Forum in the Villages, Florida. In this show, we talk to leaders of clubs and interesting folks who live in and around the villages. We also talk to people who have information vital to seniors. You will get perspectives of what is happening in the Villages, Florida area. We are a listener-supported podcast. There will be shout-outs for supporters.
This is Mike Roth on Open Forum in the Villages, Florida. I'm here today with Dr. Tyler Long.
Mike, thanks for having me.
Let me tell our audience a little bit about you. Tyler's a board-certified dermatologist and mole surgeon, and he founded Spot Doc in the Villages to bring advanced cancer detection to the community using tools like the Vectra WB 360, a full-body image system. Dr. Tyler focuses on early diagnosis and therefore has fewer unnecessary biopsies and personalized care. Dr. Long believes every patient deserves clarity, confidence, and the most advanced technology available for use in their skin health. Why is skin cancer a high risk here in the Villages?
That's a great question, Mike. I think skin cancer is an important topic in the community simply because the community loves to be outside. They tend to be over the age of 55 and have a lighter skin tone than the normal population. Those three factors are giant risk factors for skin cancer.
People in my generation grew up and there was no such thing as a SPF 50 suntan lotion. Did that dramatically increase our risk of developing a skin cancer condition?
I hear a lot of patients tell me about how they've never used sunscreen before when they're younger, or maybe they like to use iodine, baby oil, sitting outdoors for as long as they can. I hear some stories about patients that their parents told them to go play outside until they got a sunburn, and then that would be their kind of initiation into summer. But we found that those kinds of sunburns are actually a lot more problematic than we thought.
What do residents here in the Villages need to know who've moved down to Florida from the northern climates?
I think people that are moving down here, they've had vacations in Florida and understand the strength of the sun. But as you get closer to the equator, it's definitely a different type of UV damage or UV power compared to northern states. The peak UV here, midday, tends to be an 11 or 12, where northern states, they would never get above a 9.
What is it that residents here in the Villages may be overlooking relative to skin cancer?
Residents are overlooking the power of the sun, and I think they're underestimating how effective treatments can be. If we start now, we can still stop the progression of forming new skin cancer. Any amount of UV block we can use is helpful for reducing the amount of mutations in the skin that lead to skin cancer. People do lose a little bit of hope thinking all the damage has been done, but that's not the case.
Let's talk for a moment about what sun-blocking agents people should use. What are the best ones?
That's a great question, Mike, because I had a patient earlier today ask me, what is the best spray-on sunscreen? And I asked him, what's the best car? Obviously, that got a good laugh, but in reality, there is no perfect sunscreen. We're all really weighing the pros and cons of that certain sunscreen. But in general, the guidelines that I recommend for people picking a sunscreen is F30. Realistically, it is 15, but patients and people tend to not put on enough to actually get that level of sunscreen. They put on a lot less than what's used in actual research. So I find that 30 is a good medium to get you to the minimum of at least 15.
I heard there was no such thing as a sunscreen 50, and that's a made-up number by the manufacturers.
In general, the amount of sun protection you get from an SPF 30 to a 50 is very minute. For example, a sunscreen of SPF 30 means you can stay out in the sun twice as long without getting a sunburn. SPF 15, you can block out 92% of UV radiation. At SPF 30, that's 95%, SPF 50, 98%, and SPF 70, 99%. You really start getting diminishing returns when you increase your SPF. SPF 15 can offer a lot of sun protection, but unfortunately, people don't put it on as well as they should. You asked which sunscreens would be the best. On top of SPF, I think getting something that has a water protection rating is essential. That comes in 40 minutes to 80 minutes. 80 minutes is the maximum you can do. So I do recommend getting something that has an 80-minute water resistance. And then lastly, something that you enjoy putting on. People overlook that. I think it's important to get a sunscreen that doesn't bother you. If it does bother you, you're not going to use it. So really, we have to weigh all of those different features of a sunscreen. In general, I tell people we want to prioritize a mineral-based sunscreen versus a chemical-based sunscreen. A mineral-based sunscreen either uses titanium or zinc.
Mhm.
The unfortunate side effect of titanium or zinc is that it goes on extremely white. So you end up getting a pasty white appearance.
It doesn't stay white. I put it on, I rub it down.
Yes, if you rub it in, it can decrease, but you do end up looking a little bit more white. And that white overcast, people just tend to not like very much. There are nano types of sunscreen where the mineral is broken down to the smallest molecule that they can continue to do while having some UV benefit. A good brand for that one would be Elta MD, uses a nanoparticle. Those do rub in better. But I do like the mineral because of the broad spectrum that it provides. So SPF is actually rated for UVB, but there's also UVA. And UVA is not something that's considered whenever we're doing SPF testing. So UVB is what burns you. UVA is what is out at all times during the day. So from sunrise to sunset, the UVA radiation is the same. UVB peaks during peak hours like 11 to 3. But UVA still carries the possibility of causing mutations in the skin.
Can we get sunburned or have skin damage from the sun on a cloudy day?
Yes, you can. So even though it seems like it's overcast or a little bit more dim out, the high-powered UV rays in the light spectrum are still present. It's essentially light, but more powerful than light, and we can't see it. That light is not stopped by the clouds. So even though we're getting less visible light, the UV light that's coming through is just the same.
Now, is there such a thing as a spray-on mineral-based suntan lotion?
Yes, there is a spray-on sunblock. And the word sunblock has gone out of favor because it doesn't block the sun. A sunscreen is what we like to actually call it. There are spray-on mineral-based sunscreens. My favorite is Coola.
So how would you spell this, a C or a K?
Coola.
Coola.
Yes. They have a spray-on mineral-based, but it doesn't eliminate the factor of you still have to rub it in to really make sure that you're not looking pasty white. When I say mineral-based, those are the preferred types of sunscreens. The organic type, or we call chemical sunscreen, those benzones, they've gotten a lot of bad rap in the scientific community because with those benzones, you end up getting contaminated with benzene. Benzene can be absorbed through the skin and possibly cause hormonal changes. And it's quite clear that those sunscreens cause damage to the coral reefs. So those types of benzones are actually outlawed in places like Hawaii.
I noticed that they were very particular about what sunscreen you put on.
Exactly. Mineral kind of eliminates all of those factors.
And now we'll listen to Dr. Craig Curtis talk about Alzheimer's disease.
Amyloid is the spark and tau is the fire. We have this spark sparking for 20 years without symptoms. Once the spark causes the fire, the breakdown of tau inside the cell, we start to see symptoms. We are actively researching ways to stop tau as well.
Is it possible to regrow new brain cells to replace the ones tau has killed?
That's a hot topic. Scientists, for the most part, do not believe that we can regenerate any brain cells. There have been a few research papers published in the last 4 or 5 years that hint that there might be some brain cell regeneration, specifically in a part of the brain called the hippocampus, which ironically is where Alzheimer's disease starts, but it's really hard to prove that in humans.
With over 20 years of experience studying brain health, Dr. Curtis's goal is to educate the Villages community on how to live a longer, healthier life. To learn more, visit his website, craigcurtismd.com, or call 352-500-5252 to attend a free seminar.
Thank you, Dr. Curtis. Now, Dr. Long, why don't you tell our listeners about this new machine you have, the Vectra WB 360?
The WB 360 is a machine built by Canfield. It's a medical imaging company, and essentially they've put 46 stereo vision pods on 2 clamshells about the size of this room we're standing in.
A 10 by 10
Yes.
area.
It requires a 10 by 10 area.
And the machine is open so people can walk into it.
Exactly.
But it's like a much bigger than an airport body scanner.
Yes, exactly. A lot of people walk into the room and think, oh, this looks exactly like what they have in the airport. And it's really just as quick, just as easy, and much more thorough in the idea that we're capturing the whole skin surface instead of just checking for what have you.
So one side of the clamshell takes the front half of a person's body, and the other, the back.
Exactly.
So you have a 360-degree angle on the human being. For every skin on their body, there are approximately 19 million skin cells.
Yes, all visible skin. Absolutely. So the patient stands into the machine and they assume a position, elbows up, hands by your waist. Once you're ready, the technician will take the photo. 46 camera pods go off, and that captures over 100 pictures, polarized and non-polarized. The AI will help develop an entire 3D image of your entire skin surface.
Let's talk about that. Polarized. What does that mean?
So in order to get a good idea of what patterns are happening on the skin, we need to have polarized and non-polarized light. Our skin is built to reflect light. To look at certain spots and capture the correct amount of detail, we need to use non-polarized light. There is also a benefit of non-polarized light, which can help us determine surface structures, a three-dimensionality of the surface. We take both types of pictures to give us a full idea of what is happening on the skin.
So you can see a mole that's extending beyond the surface of the skin.
Exactly.
And you can actually measure that in the machine.
Exactly.
Good. So when did you actually get the machine started here in the Villages area?
We opened back in August. We've been open for about 3.5 months.
Are there advantages to the patient by being scanned in this machine?
Oh, absolutely.
As opposed to going to a dermatologist who does a full body scan once a year. That's been the standard for years.
Yes. It's been the standard for 100 years. Ever since dermatology started, that's how it was done. But as technology has advanced, we've developed new techniques and new workflows for patients that have high-risk areas. Dr. Alan Halpern, who I'm in as a partner with in SpotDoc at Memorial Sloan Kettering, has been capturing images of patients.
Yeah. And the patient comes back every year for a full scan?
Yes. Alan Halpern, ever since we could take good quality photos of the skin, has been using photos to track spots. So that's where it all began, the idea of tracking spots over time, because we've discovered that when spots are evolving or changing, that can be a concerning sign for skin cancer. Because when things aren't changing, it can't be cancer, because cancer requires change. So taking these photos was the first step in providing a more thorough skin examination.
So in your situation with this machine, the patient steps into the machine every year on the same 2 spots. The cameras are in the same spots.
Yes.
So the photographs are comparable year for changes in any abnormalities in the skin?
So whenever someone gets a repeat scan, we can look at every single spot that was on their skin. We can tell exactly how they've changed. We use a little bit of machine learning and technology to help our human eyes digest how it's changed by overlaying heat maps and different types of diagnostic imaging to help us understand how it's changed and to what degree it's changed.
You're taking a very large surface of skin.
Mm-hmm.
Does the machine tell you when you're looking at a second picture a year later which areas have changed?
So the initial photo will track each spot and create a file for each one. Some patients have up to 4,000 spots that we are tracking in a single person. Each spot becomes its own file. Over time, we can compare each of those spots. When they come in next time, we'll still be able to see all 4,000 spots and tell which are new. Each spot has a little arrow next to it that indicates it. When I get a repeat, a new arrow is green. This spot is actually new. This wasn't there last time. That can help remove some of the noise in a person that has 4,000 spots or a bunch of freckles. It's really difficult to tell which spots are new. Even just putting a photograph side by side and looking at it, the AI and machine learning will help us say this one little spot is new. So it'll help flag those spots. We are ensuring that we're not missing anything new or changing.
I understand AI, or a lot of it. You said machine learning. What is the machine learning?
That's a talk about artificial intelligence. There's layers of artificial intelligence. Machine learning is simply a rudimentary type of AI. AI is very broad. It can mean ChatGPT or your Amazon searching.
I think many of our listeners may have heard about AIs being able to detect breast cancer better than pathologists when they look at mammograms. Is this an extension of that for the whole body?
The image-based processing is still in its early stages, and we don't know why things can have higher probabilities or how things are determined to be concerning. We don't know exactly what the AI or machine learning is actually thinking. There's a lot of research on explained AI where we can relate it to a level of understanding that we perceive. For example, there's been some image-based AI where you can take a picture of an object and it can guess that object. We don't know why it picked that object. Sometimes it can be related to the actual carpet that the object is on. It's not saying the object, it's just saying that, well, I've seen a lot of pictures like this that also have this type of carpet related to this type of chair. So I think there's a gap that we have to figure out with AI, but explaining it and getting an explained AI model is going to be something that we're actually working on.
Models tend to get better over time.
Yeah.
Many people here in the villages have had multiple biopsies over the years. For you at SpotDoc, using this Vectra machine, be able to reduce the number of unnecessary biopsies?
As our data shows, absolutely. The research also supports that notion. For example, most research shows that the average amount of benign biopsies someone needs in order to find melanoma is near 25 benign biopsies to find one melanoma. So with those odds, we're doing a lot of unnecessary procedures. Anecdotally, from patients I speak to in the community, there are some offices that may be doing a lot of biopsies where every time you go in, you generally expect to get a biopsy. From our standpoint, things really need to be quite obvious for me to do a biopsy. And those situations do occur. Non-melanoma skin cancer, such as squamous cell carcinoma or basal cell carcinoma, are grouped as non-melanoma skin cancer. And then the third big player in skin cancer is melanoma.
That's the dangerous one.
That out of those three, that is the most dangerous. So for melanoma, it's very hard to diagnose because it's a small brown spot. People tend to not have a lot of big scaly spots that aren't healing. Our skin does a pretty good job at healing. So whenever we notice a spot that's not healing or is bleeding often or is red and has specific features under dermoscopy, that little magnifying glass that dermatologists like to use, those features are fairly easy to see in comparison to a very benign appearing brown spot that's just been slowly changing over time, which ends up being a melanoma.
Using the Spectra machine, will that cause more necessary biopsies?
So a lot of people think that yes, if we're increasing the amount of screening that we're doing, if we're being more thorough, they logically put that together with, oh, we're going to need to test a lot more things. But it's actually the opposite. So for indeterminate spots or spots that I'm just not quite sure on, or spots that look maybe concerning at one point in time, but I have a sneaky suspicion that maybe it's just an inflammatory bump, those spots I'll actually just recheck in a short amount of time to make sure that it's either healed or not changing. So I actually favor doing more of a watchful waiting.
Now, for people who are listening right now and who have never heard of or seen a Vectra scan, what can they expect in their first visit?
During the first visit, I generally prefer to get the full body scan. I've had some people come in that elect not to do it, and that's perfectly acceptable and understandable. But most new patients will come in and get a full scan. After checking in, they'll come into the office. We get them into a gown, and then they step into the machine at a comfort level they are okay with, whether it be having your underwear on or being completely nude. We're okay with both, as long as you understand things that are covered can't be tracked unless we add them after the fact. Once you step into the machine, you assume the pose, and that takes about 1 to 2 seconds. All the cameras flash. You step out, put your gown on, and we put you into a room. While you're in that room speaking with the medical assistant, getting all your history or any problem areas, I review the results of that image. When I look through that image, I'll filter out all of the noise so I can look at the most clinically typical spots in relation to all of your spots.
So how long does it take after someone's come out of the machine, they've taken the picture, for the machine to give you its output so that you can look at it?
4 minutes.
Takes about 4 minutes. That's not bad at all. How often should people be coming back for additional monitoring?
It all depends on what we find in the exam. In general, I will capture about 5 to 10 close-up images of the most atypical spots in a person, whether they're benign or I can take a look at them from across the room and tell that they're just benign brown spots, such as like keratosis, one of those wisdom spots we call. I'll still take a picture of it if it's the most concerning spot relative to their model.
Do you take an extra picture?
Yes. After I look at the 3D image, I'll flag the most atypical spots. When I am in the room reviewing the results, I'll do close-up images on the spots that I thought were the most concerning on that person.
So what about the spots that the machine can't scan? If we're standing in the machine, what about the bottoms of the feet, which obviously can't be photographed?
So the big problem areas in relation to capturing images are going to be in the groin, in the armpits, bottoms of the feet, and in the hair on the scalp. The hands tend to be in areas as well that don't have as much granularity. So those are all areas that I just add on to the full exam that I give you after the image.
Okay, so there's some add-ons for areas that don't get photographed based on where we're standing. Okay. Now, for our listeners here in the villages who are exposed to sun on a daily basis, just walking out to get your newspaper, what are the simple things that they can do to protect themselves?
Sure. So I call this the hierarchy of sun protection. The hierarchy of sun protection, at the minimum level, the foundation of reducing skin cancer risk and sun damage, is unfortunately avoidance. I'm not going to harp on that one because I know the villagers here definitely enjoy being outdoors, and I'm not going to tell you to not be outdoors.
You convince people to play.
That's the next level, is covering up. So using UPF rated clothing, maybe a PFG, there are other brands that provide long sleeve. Those actually have a UPF rating similar to an SPF rating. If you take off your shirt and pull it apart and see through it, light's getting through that. These types of UPF rated clothing will provide the same level of benefit as being not in the sun. Next to UPF rated clothing, I'd recommend using shade whenever you can. The same concept of staying out of the direct sunlight. If you can't stay out of the direct sunlight and you can't cover up, avoid peak hours. So 11 to 3, I would just make sure to do an early tea time or a later tea time during the summer. Definitely has the dual benefit of avoiding most of the heat for the day. But if you can't do any of those, then cover up with sunscreen. Sunscreen is a last-ditch effort for me. In areas that you can't cover up, sunscreen is a great option, but I wouldn't rely on it entirely. It does have its limitations. It does wear off over time. Reapplying is important, especially if you're outdoors for a long period of time.
So our players of water volleyball.
So I have a few players that have already been on top of it, wearing UPF rated clothing to help reduce their sun exposure. Reapplying sunscreen on the back of the neck, ears, hands, and any exposed areas is also important.
What about eyelids?
Eyelids are important.
Could people put suntan lotion on their eyelids?
You can. It is problematic because it will run. It can get in your eyes. The benefit is that the eyelids tend to be less affected than the ears and the forehead and the nose. The weighing of benefits to applying to the eyelids, I'd recommend wearing it.
Do you see a difference between a spray-on screen and a tube of liquid gel?
One's a lot easier to put on.
Which ones work better? That's my question.
The spray-on sunscreen is a lot easier to use. You do end up having to rub it in, and it's a lot easier to put on the recommended amount to reach that research level SPF rating versus lotion. So I do prefer spray-on. On the face, I do not, just because the aerosols tend to be problematic around the eyes and the nose. So I do prefer to do a lotion for the face.
Interesting. Now, if someone wants to find you, to find out more about the Vectra scanning system, how do they do that?
We have a lot of options to come into the office. We are a new office, so we are accepting new patients, and we have availability pretty much any time of the week. We have an online website that you can go on and actually schedule your own appointment. You can book directly from Google, and you can even call us, walk in.
What is ZocDoc?
ZocDoc is a platform for local providers. So essentially all the local doctors create a profile on ZocDoc, ZocDoc. They create a profile, upload their schedule, and you can book directly through ZocDoc. You can filter for all of the providers in the area based on your insurance or services they provide. There's an easier way for patients to find and compare doctors.
I've never seen that.
Yeah, it's actually very popular here in the villages.
What are the extra services that you're providing besides the skin cancer screenings?
As a skin cancer company, we prioritize finding and treating skin cancer. We want to stay in that lane and provide every service to treat any skin cancer that we encounter. That includes treatments such as photodynamic therapy.
Big words.
Photodynamic therapy. We call it PDT for short. So essentially what that is a treatment where you come into the office, we apply a photosensitizer, light-activated medication onto the face, scalp, or ears. We let you sit underneath a special light for about 15 minutes, and that'll cause all the skin cells that have mutations to kill themselves. It's a way for us to do a field treatment to reduce the downstream possibility of skin cancer. It's a quick and easy way for us to treat actinic keratoses. Those are common types of precancerous cells. Essentially, those little red scaly spots on the face are a sign of sun damage. We do something called electrodesiccation and curettage or EDAGE. We call it EDC. We diagnose a skin cancer, numb it up, shave it off, burn the area, and keep doing that until we reach normal skin. Skin cancer cells don't adhere to skin very well, so they peel off normal skin. This method allows us to remove possible skin cancer by scraping off the top layer of skin cells and letting it heal. And then we do things like excisions. That means that once we get a cancer diagnosis, cut out that skin to make sure we got it all.
You send those to a lab?
Correct. Those labs will give us a result saying whether or not that skin cancer went to the margin. So we'll take a little bit of margin of normal skin just to make sure that we get it all. And then that's just based off research. Some skin cancers need a 4 millimeter margin. Melanomas sometimes need a 1 centimeter margin, so almost 3/4 of an inch margin of normal skin. So sometimes these little skin cancers can actually turn into pretty large areas of skin being removed just to make sure we get it all.
What is your opinion about using radiation for skin cancer?
I do think radiation is a really good option for skin cancer, but I do not think it's the best. Radiation is great because it has the ability to avoid cutting into the skin, but the cure rate is lower than doing a standard type of skin surgery. So while the cure rate is acceptable, it is not the best.
What percentage are you talking about?
Radiation can have a cure rate from 90 to 95%, while surgery for a basal cell has a 99% success rate. Radiation is great for select patients in select areas. If you have skin cancer on your back, it makes more sense to just cut it out, have a higher cure rate, and then call it a day because there's a lot of skin on the back. If you have a spot on the eyelid or on the ear where you don't have much skin to repair the area, radiation may be a good option.
Good. Why don't you give our listeners a phone number where they can reach you and your website?
Absolutely. So if you want to call our office, it is 352-914-3451. And our website is www.spotdoc.com. That's spotdoc.com.
Great. Thanks a lot, Dr. Long.
You're welcome.
Remember, our next episode will be released next Friday at 9 a.m. Should you want to become a major supporter of the show or have questions, please contact us at mike@rothvoice.com. This is a shout out for supporters, Tweet Coleman, Ed Williams, Dwayne Romick, Paul Sorgan, and Dr. Craig Curtis at K2 in the Villages. We will be hearing more from Dr. Curtis with short Alzheimer's tips each week. If you know someone who should be on the show, contact us at mike@rothvoice.com. The way our show grows is with your help. Text your friends about this show if you enjoyed listening, or just tell your friends about the show. We thank everyone for listening. The content of the show is copyrighted by Roth Voice 2025. All rights reserved.